So I wanted to share with you kind of my process. About a week ago, I experienced a severe tweak in my hip, and I had no idea, what it was about, why it happened. It was literally, I was just standing in my living room. And I did what most people do and conveniently ignored it and went to Pilates and continued to work out, which was a big mistake. And then I kind of came to my senses, brought myself back into reality, and really thought about what I was doing, the choices that I was making, and then also, kind of figured out a game plan from there. So I shared with you on Tuesday how I was doing and, the first 3 steps that I take. And the thing is that you can do any of these in, you can do all of them at once or all of them in one day, or you can, kind of space it out as you feel comfortable. The first thing that I did was decide to take an anti-inflammatory. And why did I take an anti-inflammatory? The reason being is that when you have an acute injury, there's inflammation. And inflammation is really bad. We know it's bad systemically, but it's really bad for your joints. And it's really bad for your joints because for every cubic centimeter of inflammation, a muscle shuts down by 1%. The muscles that are closest to your joint, where there is inflammation, are your stabilizing muscles or your core muscles, they're often called. So many people know of the abdominal core muscles, but we have core muscles in every joint. And the core muscles, their job is to stabilize and protect the joint. So think about it. If you have an inflammatory process, those muscles are being shut down and they're not being able to work. So a bunch of bad things are happening to the arthrokinematics of that particular joint. So the stabilizing muscles aren't working. Then the moving muscles are working. They're trying to kind of take over for the stabilizers that are being shut down. And as a result of that, they tend to get hypertonic or tight because they're doing a job that they're not designed to do because they're taking over for the stabilizing muscles. So you really have to combat inflammation. How you do it is your choice. You can do it naturally with herbs like turmeric, CBD oil, tart cherry juice. There are a lot of research studies out there about the anti-inflammatory qualities of natural substances, or you can go ahead and take aspirin or naproxen or something that is more traditional. It really is a choice depending on what's available to you and what you feel most comfortable with. You can use modalities as well if you happen to have them available to you, like acupuncture, laser, and those kinds of things. It doesn't matter what kind of anti-inflammatory that you use, as long as, number one, it works, and number two, you have it available to you quickly. And the next thing that I talked about was an analgesic. So an analgesic is something that relieves pain. Now, this is where it gets a little bit tricky, because you don't want to mask pain, because pain is your body's way of telling you that there's something wrong. However, when you are in pain, you adapt your movement patterns in a negative way. So you might limp, you might have an antalgic gait, you might move your arm in a guarded manner or hold it in a guarded manner. So there's a balance between analgesics and the anti-inflammatories and how much pain relief that you really want. You have to be at this point extremely mindful of your alignment and your movement patterns, because you don't want to, again, develop a limping gait, because that is going to be something that over time will become an unconscious learned habit and cause you further problems down the road. So you want to be able to decrease the inflammation so that you don't shut down those core muscles, and I'll get back into what you do to combat that as well. And also create enough of an analgesic that you're not experiencing pain in a way that would negatively affect your movement pattern. But there's another thing about analgesics. When you have the experience of pain, there's adaptations that go on in the brain that actually make you more susceptible and more sensitive to pain in the future. And you don't want to get into that road either. So again, this is a delicate balance between anti-inflammatory and analgesics, and I'll let you know how I handled it for myself. The next thing, if it's a lower extremity problem, or even if there's an upper extremity problem, some sort of an assistive device. Again, to maintain normal quality of gait without putting excessive stress on a joint, but also alerting people in your environment that something is going on with you to kind of stay away. So I did this when I avulsed a toenail very long time ago, and I was traveling on the subway. I had a crutch on me, not because I necessarily had an altered gait pattern. I just didn't want anyone stepping on my toe because that would have caused a bigger problem. So again, to maintain quality of gait without increased stress, an assistive device would be maybe a great idea, or some sort of immobilization device for an upper extremity, like a brace or sling, in certain situations. In safety situations, it's a different story. So again, we don't want to cause further problems. And lastly, and I did not include this in the first time, but I did it, make an appointment. So when I shot the video, I actually had an appointment with an acupuncturist later that day, because the sooner you can start to address a problem with a professional, the better off you're going to be. So, when you have something that comes up, make an appointment, because sometimes it's hard to get an appointment. So it's better to have the appointment and cancel it or not need it than need the appointment and not have it. So I already have an appointment in 4 weeks with an orthopedic surgeon, just in case I can't resolve this issue myself, which I feel every confidence that I can. But why wait another 4 weeks of suffering, or, have your deadline about when you need an intervention? But again, the sooner that you can get it, whether it be massage therapist, acupuncturist, MD, physical therapist, whoever is in your team of healthcare people, make that appointment ASAP, because you're going to probably need some sort of support. You can make it with me, and I can usually advise people remotely or in person as to what to do. And in fact, in the Correct to Size program, I have different parts of the body as to different muscle groups to address with a massage therapist, because, like I said, when we have that inflammation, the core muscles are shutting down, so the accessory muscles are doing too much work, and they are going to become restrictive, tight, and angry, and they're going to need to be released, which is what I'm going to talk about in a few minutes. So the next 3 things, so that's 4, here's number 5, stabilize. When you have a problem at a joint, usually it's due to one of 2 things. Either the joint is moving too much, it's unstable, right? And that can be because of muscular imbalance. That could be about something that's been going on for a long time, probably like what happened with my hip. There's probably an imbalance, and then I reached kind of a tipping point. So I want to stabilize. Now, I can't brace my hip, but I can tape it. And I do have dynamic tape. And those of you who know my work know that I'm a big fan of dynamic tape. And it is a tape that allows you to move, but it supports you quite a bit. It has the capacity for, I believe, 33 pounds of force to either offload a joint or to assist a muscle in moving. So in this case, I'm trying to offload the joint, and I can tell you a very simple technique that I do with that. The next thing is Mobilize. So Mobilize is releasing connective tissue. And I do that through two techniques, usually rotational release as well as the comprehensive core. And again, when you have an issue, like, for example, my hip, I don't want to just release the connective tissue around my hip, but I have to recognize all of the contributing factors to my hip. My hip is not just my femur, and it's not just the ball, but it's also the socket. So I have to address what's going on in my pelvis, which is where the socket is. So that would include connective tissue in the pelvic floor, in the abdomen, all the way up to the diaphragm, that frankly will impact the pelvis or the socket of the ball joint, right? So all the way from the coccyx, my tailbone, through the pelvis, through the pelvic floor, through the abdomen, all the way up to the diaphragm and the lower rib cage, ribs 11 and 12, as well as going into the thigh muscles and even the lower leg, the calf, and certainly the foot will impact because the base of support will impact everything that's going up around it. So when I'm taping, I am also addressing in particular my big toe, which is my primary balancer. And I've had a lot of people resolve hip problems and knee problems. I avoided surgery, and I still have now for over 12 years in my knee as a result of addressing the big toe. So again, I go into that quite a bit in the programs, and I can talk about that a little bit more. And the next thing is stability exercise. So you want to exercise, but you want to safely exercise. And when you're safely exercising, we're talking, remember, we're battling the inflammation, right? We're battling the core muscles. The core muscles are not movers, they are stabilizers. So the activities that we're doing should be stationary or non-moving. But that doesn't mean that the muscles aren't working. So the next live presentation that I do in Correcticize, I'm going to go through exercises to do at your desk or in your car. And a lot of them are stability exercises, or what we call non-moving exercises, also known as isometric contractions.